Hi, I'm Dr. Lopez. I work at WellMed at Hampton.
Hi, I'm Dr. Atkinson from WellMed at West Camp Bowie.
Hi, my name's Jennifer James, and today we're going to talk about general health and wellness.
In general, a good exercise program incorporates cardio, resistance training, and stretching. Ideally, you want to perform resistance training, which are your free weights, resistance bands, or body weights 2 to 3 times per week. You should warm up and stretch prior to and after exercise.
There's a lot of profound health benefits that can come from exercise. Just incorporating some kind of physical activity during the day, definitely find something you enjoy doing, such as aerobics, swimming, or dancing. It doesn't have to be lifting weights at the gym. Yes, absolutely. UV rays can still penetrate through clouds.
So whether or not it's cloudy in the sky or sunny, a minimum of 30 SPF sunscreen is recommended to be used every day. It's most important on your face, but it's also important on your body.
When it's hot and sunny, it's easy to remember to put on your sunscreen. When it's cool and cloudy, it's more difficult to remember, but those UV rays are still affecting your skin.
Even if you have clothing on, the UV rays can actually penetrate through the clothing and cause skin changes or even cancer.
So anytime you're going to go outside, go ahead and put sunscreen on. Just remember you need to reapply every 2 hours.
Protein is a necessary part of your diet that most Americans just don't get enough of. The typical American diet tends to focus around carbs or carbohydrates, which are great for quick energy, but protein is essential for muscle and other vital functions, especially as you age.
10 to 35% of your calories should come from protein. When you look at your plate, about a third of it should be protein. Protein can come from a variety of things such as lean meats, tofu, eggs, nuts, beans, cottage cheese, and lentils.
In general, 0.8 to 2 grams of protein per kilogram of body weight is recommended. The exact amount will vary depending on how much you're already consuming, your age, whether you are looking to lose weight. Individuals who are very sick, such as patients in the ICU, may actually require a lot more protein than someone who, say, has a sedentary lifestyle.
And remember, you should always have a balance of protein to carbs to healthy fats in every meal. As we age, one of the things we worry about most for ourselves and for our family members is whether or not they're going to fall. Our strength and balance tend to decline as we age. Part of this is that we're not as active as we once were. Part of it is that we're not taking in enough protein sometimes.
To help reduce the risk of falls, you want to make sure that you're staying active, first of all, and address any sort of fear of falling. Make sure you're up to date on osteoporosis screening. Additionally, you may want to address things like your vision. Make sure you've got good night vision, good balance, so that way you can kind of minimize that. Have someone evaluate, maybe a therapist or even your doctor, to see if you need any sort of assistive device like a walker or cane to help support your walking throughout the day.
One of the best things that you can actually do is be very proactive in your exercise, in your walking, and lifting weights. Being able to strengthen things like your abdomen actually helps if you become unbalanced to catch yourself.
If you show any signs of fatigue, maybe shortness of breath, or decreased endurance with your physical activities, you should consider getting a health evaluation, maybe schedule an appointment with your doctor to see if you're in optimal health.
I would definitely recommend going to your doctor pretty routinely to get routine labs. There's a lot of screening exams such as mammograms, colonoscopies, things like that, that we use to catch things early so we can treat them early. By going to your doctor regularly, they can screen for these things and can treat them appropriately. Like the things I usually see in the clinic are pain. If you're having pain anywhere, you probably need to get it checked out. Emergency room should be limited to chest pain, shortness of breath, bleeding out of your arm, things like that. But as a general rule, if you're having symptoms, you should probably go see your primary care doctor.
Many of us put off going to the doctor. However, it's very important to go to your doctor before things happen. So in order to do that, we really need to focus on preventative measures. So these would include things like yearly blood work. They would include things like getting your mammogram, colonoscopy.
You should meet with your doctor about once a year at least to ensure that you get adequate screening, make sure you're updated on your vaccines, perform any necessary cancer screenings, and more often based on your medical conditions and whether or not they're controlled.
Thank you for watching. If you have any further questions, please go to wellmedhealthcare.com.